How do you know if the surgeon that you are selecting, if the surgeon that you're sending your patient to is the appropriate surgeon for this technique? You are looking for a joint replacement surgery or an angular limb deformity. So if you got one of those, don't be looking at me. I am not that surgeon. Yes, I know how to do them. Yes, I've done them. I'm not going to do a good job for you because I don't like doing them. I don't do enough of them. You need to find somebody who's not just going to say, yes, I'm going to do that for you. Why? Because I'm a board certified surgeon and that's what I do. No, you want somebody who is going to do a good job for your patient and your client. You want somebody that has experiences with these procedures, even if they're a board certified surgeon. If they just went out and did a hip replacement course, but haven't had a chance to work with a mentor on this surgery, they may not be the person you want to do this procedure for you. You want someone who has experience with these more complicated procedures. Here are some of the questions that you can ask the surgeon when you are intending on sending a case to them to find out if they are the appropriate person to help you with this case. And it's appropriate to ask these questions. So they may seem a little bit foreboding at first, but they're very appropriate. It is appropriate to ask them how many of these surgeries have they done within a specific time frame and what their success rate is. But don't stop there. Ask for references. I think it's appropriate to try and get 3 references, and they should all be pretty recent. So you don't necessarily want one that was done 12 years ago and one that was done 7 years ago and then one that was done last week. Preferably, they've all been done within the last year or so. Speak to the references and ask, how did the surgery go? Approximately when was the surgery done? Exactly what surgery was done. Make sure that we're talking the same surgery that your patient is about to undergo, and how well did the surgery go? Now, if there were complications, which complications occur? Don't let those scare you. They're frustrating when they occur, but what's important is how well were the complications handled? How supported and how present and responsive was the surgeon to dealing with the complication? A lot of complications can be managed without a lot of undue stress and strain and difficulties. They don't all mean we're going to go back to surgery. The other thing you're going to want to ask them is, how good was the post-op care? How much follow-up did they receive? Were they seen on a regular basis? Were they seen twice and that was it? Did they get instructions from the receptionist or from staff? Did they actually see the surgeon on the follow-ups? Did they feel well supported so that they could bring their pet to the best outcome possible? And that, the best outcome possible, really comes from the post-operative care. So ask the questions, don't be shy, find out. A lot of money is going to be spent to have this less common, more difficult surgery done, and there's going to be a lot of stress associated with that for the pet owner. Do your homework.